My name is Dr. Rosina Ali. I'm a reconstructive aesthetic plastic surgeon and I work at the Allel Clinic in London. I'm interested in the patient's concerns and the patient's lifestyle. And I think rather than simply saying genetics or you're going to age like your mother or your father, it's really nice to be able to say your lifestyle or where you live or your eating habits or your skin type is contributing to why you age the way you do. And these are the measures you can take to improve your aging.
My name is Kambiz Golchin. I'm a facial plastic surgeon based out of Dublin and London. I've been a consultant facial plastic surgeon for the past 12 years. I'm very passionate about the world of aesthetics, in particular facial aesthetics. The trends that I'm seeing is that more people are looking for a natural look, and definitely less is more nowadays. We now know that 50% of the aging process is intrinsic, which means it comes from within. So having that knowledge and having a DNA proof is really key in terms of our understanding, but actually being able to do something about it for our patients. Allel is very unique. With Allel, we can look at individual markers, which is actually 16 markers that have been scientifically validated, which looks at the aging at a DNA level. The nice thing is that now we have the ability to address those issues with specific skincare, which is needed for those individual markers.
I was really interested in collaborating with Allel because it's a very science-based skincare, and I thought the DNA analysis was really inspired because it was able to give patients something that was directly relevant to themselves. I have witnessed some really good results from the Allel skincare. So I use the T, which is the pigmentation. So I use the serum and I use the cream together, and it's the equivalent of a good skin day every day.
I'm Dr. Susan Mayu, a consultant dermatologist here at the Allel Clinic in London. During my time in dermatology, there's been an increasing interest in cosmetic dermatology. And on the back of many consultations for psoriasis or lumps and bumps, people ask for advice on their skincare. Up till now, skincare has largely been a case of one size fits all. I think the way that Allel stands out is that it's providing us with a targeted approach to particular problems an individual has. So even though our clients are now very well informed, it's still a confusing array from which to choose a good moisturizer, a good anti-ager, and many products don't live up to that.
I think Allel is a pioneering skincare brand because it's DNA based. So it's absolutely specific to you, which I think gets rid of a lot of the unimportant things in a consultation. So if I can say to a patient, the key driver to aging in you is, for example, pigmentation and sun damage, and perhaps a moderate driver is your sugar intake, then not only can they consider the skincare, they can consider lifestyle changes which will help them, and they can consider other surgical or non-surgical rejuvenation techniques which will help them. And I think that's so much more powerful than talking about your skin type or your age group. I'm actually talking about you, DNA specific.